Hi, this is Kristen here at UT Southwestern Medical Center. Thank you for joining our Facebook Live chat on colorectal cancer with Dr. Syed Kazmi. Dr. Kazmi is a gastrointestinal medical oncologist with the Harold C. Simmons Comprehensive Cancer Center. His clinical practice is focused on gastrointestinal malignancies, and his research is aimed with colorectal cancer. So I'm super excited to have him join us. As usual, don't forget to like and share this conversation. You know, it's a very important topic. It's been in the news quite a bit lately, as it is Colorectal Cancer Awareness Month. And also be sure to write your questions in the comments field. We'll take as many as we can get to in the next 20 to 25 minutes. So we're going to go ahead and get started with Dr. Kazmi.
Thank you very much.
Thanks for joining us today.
Thank you.
Absolutely. So you've been here a year and a half. You're a gastrointestinal medical oncologist. You know, I've been hearing a lot about colorectal cancer in the news lately. You know, are there different types of colorectal cancer?
So number one, colorectal cancer is a common cancer.
Mm-hmm.
It's overall annually around 135,000 new cases are diagnosed of colorectal cancer in USA, and then approximately 40,000 patients pass away from colorectal cancer. It's a very relevant disease that needs to be taken care of. Colon cancer in general, there are different molecular subtypes that we are increasingly identifying. However, it's a disease that's generally uniform. Now we are noticing difference between the right-sided colon cancer versus the left-sided colon cancer, but generally we lump together.
Okay, good to know. So we are starting to, we're starting to get questions in already. This is great. I know we've got quite a few of them. The first question, and this is mainly what I've seen in the news so much, is that the rise in younger adults. And Anna's question is, what is the risk for younger adults?
So again, very good question. Some background will be important in this sense. So since peak incidence of colorectal cancer in 1985, screening guidelines were recommended, and using that screening guideline, the incidence of colorectal cancer has been declining, at least in patients above the age of 50. And also we have seen that because we are catching these cancer in a pre-cancerous phase, the death from colon cancer is also decreasing. But screening starts at age 50 and above. So below the age of 50, we have realized in the last several decades now that in the last few decades, the younger population, this incidence of colorectal cancer has been on the rise. So things that may play a role are general risk factors like obesity, our diet with processed meat, lack of physical activity, rise of smoking and consumption of excessive amount of alcohol. They can all play a role. So lifestyle changes are probably the reason why this cancer is occurring.
It's interesting, and that's definitely seems to be the result of many issues, that's impacting heart disease and many other.
Absolutely, you're 100% right.
Okay, so we've got some more questions. Here's one, and you just addressed this a little bit, but Christy's question is, what are the options for colon cancer screenings for people who maybe don't have anybody to drive them home after the procedure?
So excellent question. Again, these are very, very amazing questions. So so screening is important. That's very, very most important thing to remember. Now, what are the different ways of screening for colon cancer? So there are some structural tests, and then there are some stool-based tests. So example of structural test would be a colonoscopy, a sigmoidoscopy, where you just screen for a portion of colon, and then example of a stool-based test would be looking for blood in the stool through a special test, or more recently there's a stool DNA test that has been identified in regards to cancer screening. Now, advantages of a structural screening test is you can do a colonoscopy. If you can find a polyp, you can remove it at the same time. The advantages of a stool-based test, that's easy to perform, It can be performed, at home as well, and then you can mail the information to the physician, and they can have it checked.
Okay.
So the most important thing to remember is there are many options available for cancer screening. It's just not colonoscopy. So anyway, wherever you talk to your doctor, make sure that you talk to your primary care doctor, and if they recommend that it's appropriate for you to get screened for colon cancer, then definitely there are many options that you can undertake.
Okay, so should you work with your primary care physician to identify the type of screening that's appropriate for you?
So it also depends upon resource availability as well. So underserved areas, there may be a lack of resources, so a stool-based test might be the best test to do that. But then you do it, on a regular basis so that you can catch that. Right?
Gotcha.
If you find the stool test to be abnormal, then the next test is to do a structure-based test, colonoscopy, for diagnosis purposes.
Okay.
So both these tests have a role to play. It's just that I think being familiar with it and what you're comfortable with, and making sure that you get screened.
Okay, really important and great question. Thanks for that, Christy. Here's a different question, and it's something that I think a lot of people wonder about, but it's from Ellen. Are there any obvious symptoms that are related to colorectal cancer?
So colon cancer starts from a small polyp and develop into a cancer, which can take some time. Once the colon cancer has formed, then it can cause symptoms of bleeding.
Okay.
So people can notice blood in the stool, or during normal lab work, a person may be identified to have anemia, and that may trigger more further testing. People may have obstructive symptoms, meaning they have difficulty passing stool. The caliber of the stool can diminish in size. Pelvic pain, unexplained abdominal pain that has persisted for a long while.
Okay, so not just if you're sitting on the couch and suddenly you have a lot of pain. That's not something necessarily to worry about.
Generally not. Usually, it causes symptoms before it reaches to such a degree where all of a sudden the pain happens. But most of the time, it's a lot of time it's insidious. It just slowly causes symptoms, and that's why you catch cancer later. So it's important and that's the importance for screening, right? But if you reach that point where the cancer has been diagnosed, these are the symptoms that it can present with: obstruction, bleeding, abdominal, stool differences, and then pain.
Okay, good to know. Great question. Related to those in-home mail-in tests, Crystal asks a question: just how accurate are the in-home mail-in colon cancer screening tests?
Good question. Right? So it depends upon. There are some test features which is called sensitivity, which means ability of a test to pick up disease, and usually for the stool-based test to be able to pick up cancer, it is a sensitive test. So in that ranges, that's variable, but different studies have shown range between 80% to sometimes 90% in detecting cancer. Stool tests are not very good in detecting polyps as such, but they're good in detecting cancer. Okay. In-home mailing test also, I think, use that as an opportunity.
Okay, sounds great. Great question, Crystal. Thanks for bringing that up. That brings up a question that hasn't been asked yet, but that I've heard many people talk about. What is a polyp, and how are those detected?
So good question. So polyps are abnormal growth of cells in the lining of the colon. They form slowly. So some changes happen at a cellular level, and that because of that, the one cell has an advantage of outgrowing the rest of the cells, and they start multiplying. One cell into two, two into four, they keep multiplying at a different pace, and they form a small growth. That's a polyp in the lining of the colon. Most of the polyps are benign, but some polyps have a pre-cancer, meaning it's not cancer, but may develop into a cancer, and eventually some develop into a cancer. So there's a spectrum from benign polyps to polyps that have ability to transform into a cancer.
Gotcha. Okay. So related to that, Anna submitted another question, and the question is there a genetic component to all of this, whether it's polyps or colorectal cancer? And is there also genetic testing available?
Great question. So whenever a person comes and meets with primary care doctor and they are assessing them, the question comes about what's a person's risk of developing colon cancer. So there are some genetic conditions that run in the family.
Right.
These hereditary conditions, they increase the risk of development of colon cancer beside other types of cancers.
Okay.
And for that specific population, especially if there are many members of the family with colon cancer or several family members with cancers, genetic counseling is available. And if suppose a high risk genetic abnormality is identified in a person or in the family, then their recommendations for screening colonoscopy is much different than an average person. So yes, there is a component of colon cancer that runs in family, and definitely, it has to be discussed further with the oncologist to see if you need a genetic counseling. Usually you see such genetic syndromes that have more predisposition for colon cancer in younger patients. So those patients present at an early age.
So does that then impact when a physician might recommend you begin screening?
Absolutely. For sure. So if that high risk group patient who have a familial syndrome that predisposes them to develop into cancer, you start screening at a much younger age.
Gotcha. And what are the average recommended ages?
So it depends upon different types of syndromes. So for some, you start at age 18. So once you reach adulthood, then you start, doing screening on a regular intervals. For other ones, it may be around age 30. But then on regular basis, not just one-time screening. And sometimes if they find something abnormal, they may see more doctors, a surgeon, for possibly a lot of time big, treatment decisions that need to be made for those individuals.
Okay, makes sense. So we have a question here from Jennifer, and these are great questions. Definitely keep them coming. I know we have maybe about 10 minutes left, so if you have last minute questions, please submit them now. But Jennifer's question is colon cancer more prevalent in women or in men?
So very good question. So I think it's, and I don't, from the top of my head recall the exact, incidence in men and women. There may be some small differences, but it is almost equal in my mind. Maybe a small difference that you might notice in maybe more predisposed in men, but not something that we should say women should not undergo screening. Every average risk person, men and women, both should undergo screening after a certain stage.
Okay, great question. And then here's another one that we talked briefly about earlier, but are there different types of colorectal cancer? You've said a couple different times that there are different.
So we are finding new types, not types, but I'll say dividing colorectal cancer into different subsets.
Okay.
That might be a more appropriate word for that. For example, recently, not recently, we identified a group of colorectal cancer patients have something called microsatellite instability. It's a scientific term, but what it means is that there are a lot of mismatch DNA damage in that small group of patients. And recently we have identified that immunotherapy really works well in patients who have microsatellite instability in their colorectal cancer. Then there's another group of colorectal cancer patients that have mutation in a gene called BRAF, B-R-A-F. So I think piecemeal by piecemeal we are identifying different subsets of colorectal cancers that may behave differently or that may require different types of treatment.
Interesting. Great question. These are really great. Here's one from Connie, and that, does a positive FIT test mean that I have cancer?
So excellent question again. So a positive FIT test, if you see, I think you should definitely reach out to your primary care doctor, discuss that result, and it may require you to have a colonoscopy.
Okay. All right. Great question. Thanks for bringing it up. another question here that we touched on briefly, and that I think you know quite a bit about. But what are the treatment options for this particular type of cancer?
Excellent question again. So treatment options differ based on the stage of cancer.
Okay, that makes sense.
For stage 1, 2, and for stage 3 colon cancer, usually we begin by surgery first, and depending upon what we find in the surgery, some people may benefit from chemotherapy after surgery, and some people may not, and it's a discussion to have with your oncologist.
Okay.
In stage 4 cancer, which means the cancer has metastasized to other organs, in those patients, usually we start off with treatment that goes into the blood, either chemotherapy, immunotherapy, or other treatments, and then some patients may need surgery, some patients may not need. So that's more, complex, and the decision has to be made with your, oncologist when you meet with them. But generally, these are the mainstay of treatment: chemotherapy, radiation treatment, and surgery, and that use, and then clinical trials. I think we are seeing improvement in colon cancer treatments, and as a part of an academic institute like UT Southwestern Simmons Cancer Center, we want to improve that further. We want to make sure that most of our patients do well, whatever stage their cancer is.
Absolutely.
So clinical participation in clinical trials is extremely important for patients with colorectal cancer.
Okay. And I know we have a number of studies, clinical trials that are underway here at UT Southwestern. We'll be sure to share a link to our Find a Clinical Trial in the comments section, so that if you're interested, or if you know somebody that's interested, I'd encourage you to participate. For these trials, I imagine you need both individuals who are dealing with colorectal cancer as well as healthy volunteers. Is that generally the case?
So generally, the clinical trials that we have for colon cancer are designed toward patients who have or fighting colon cancer.
Okay, good to know. So we've talked a lot about screening. We've talked a lot about different treatments. Have there been any breakthroughs in treatments for colon cancer?
I would say the biggest breakthrough has been the identification that immunotherapy works really well in patients with colorectal cancers with microsatellite instability. I think also in the BRAF mutation testing, there has been some recent trials that showed a new combination is working better than the conventional one that we use, and there's definitely a lot of room for improvement in improving the life of our colorectal cancer patients.
Fascinating. So we are about out of time. I want to give Dr. Kazmi a chance here to tell us, is there any kind of message that you want to leave with our viewers and people that may watch this later about colorectal cancer and the work that you do?
So this is a colorectal cancer awareness month. I think the first and foremost important thing is talking to your primary care doctor about cancer screening. This is a preventable cancer. It can be caught early and at a polyp stage, and that can save lives. So cancer screening, colorectal cancer screening saves lives. So please go ahead, talk to your doctors, and get that screening test done. Whatever you like, just talk to them.
Okay. And related to Sarah's question, we do all of those tests here, correctly? If you need a colonoscopy, if you need genetics, they're all available here?
They're all available here. I think we are a comprehensive cancer center. We are NCI designated, and we provide all these facilities.
Okay. Well, I want to definitely thank you for your time. I want to thank all of our guests for the wonderful questions. So this chat, as always, will be available here on Facebook for you to come back and watch it. And we will also be posting it on our YouTube channel later this afternoon. So if you have friends that aren't on Facebook, please encourage them to watch the version on YouTube. And mainly, though, I want to say thank you for the opportunity to talk with you today. This has been a wonderful conversation.
Thank you very much.
All right. Thank you, and have a wonderful day.